Hello, dear aquarists. Today, my fish disease case 124 about the Bumble Bee Goby. Bumble Bee Gobies are very cute and nice fish specimen which are collected in the wild, but sometimes they cause problems. And here I will discuss the case of this Brachygobius doriae, or the Bumble Bee Goby, with a parasitic worm infection and a bacterial infection. Here you see him swimming in the aquarium, and you see that some are getting skinny, emaciated, they're getting very weak, they don't eat, and some will die. So every day there were some losses reported after the import of this bumblebee goby. And we took some skin scraping of that fish, and we found lots of bacteria. Here you see it in the fluid, spotted and stolobacteria. Here we see it on another part of the scraping. Here you see the big colonies of bacteria which were collected. We see some of the stacks here. So that's a lot of bacterial load on the skin. Then we found in the gills encapsulated Metacercaria, or larvae of digenetic Trematodes. You see them here, you see them here, you see another part here, see here and here and here and here. And they're deforming the gills and making the gills a poor respiratory organ. So the fish, of course, will suffer and get weak and get other infections, particularly like bacterial infections. And here in the video, we go inside the fish. Here we see parts of the intestine with a little bit of food inside, not so much food to see. And we found eventually here encapsulated nematodes. In it, we see here the spleen, which is in bad shape. We see here the liver, which is in bad shape. And well, showing that this fish was in a very poor condition, of course, with worms and secondary bacterial infections. So, well, those who are suffering very badly, well, they will not be able to treat because, to be honest, the encapsulated worms cannot be treated. And that weakens the fish. And that the treatment doesn't allow to penetrate and kill the worm. The worm is just waiting there and to be eaten by a predator, bird or fish, and then it became a larger worm. So the fish is just an intermediate host here in this case. And the fish get weak, and then secondary bacterial infections do occur, and they will not eat, and they will waste away. The most weak specimens will not survive, so the 2 weak fish, they are too weak to start eating or to regenerate, and we would recommend to euthanize them with Narcomor Plus from Aquarium Munster, which is one of the soft and easy ways to put fish asleep. An antibacterial treatment with antibiotics could help the fish, some of the fish. You can try it. It's important to get them eating with food, like good quality Artemia mosquito larvae. That's the kind of food of what this kind of goby likes to eat. And you can supplement it with functional additives or probiotics or prebiotics. And check your supply, because it might be that the supplier should get you better fish. The supply is usually an area where those fish coming from a poor environment, or just a lot of risk of getting infected. And some river parts are better than the other ones. So the fisherman should be informed and to take appropriate actions where he can. So this is a special case about the Bumble Bee Goby, which I've seen often coming down with this problem. So I just want to share my findings with you, and I hope it helps you in dealing